So at Atrium Health, within the Department of Surgery, we have actually done a lot of work in the area of training surgeons. The old model of see one, do one, teach one works, but with the 80-hour rule restrictions and with the changes that are happening in the field of training right now, this might not be the most appropriate method. Especially now, we have super specialists, and many of the disciplines are so complicated compared to the surgery that was taught 40, 50, 60 years ago. So today, we're trying to develop methods by which we can train the next generation in a more educational way using the tools we have today. The residents get to actually watch videos of the index operation for each faculty member. And it has an edited component where the video is edited with narration that explains the steps, but also has an unedited version that shows the entire video. And the resident or the fellow or the trainee needs to watch that video over and over again to develop the mental model of the steps that specific surgeon does. So when they come in the OR, they have clear expectation in their mind what they're trying to achieve. Then we work with them in the simulation lab and we try to achieve specific goals that mimics what we do in surgery. You have to have a mental model and you have to practice on your own. This is one of the most fundamental things that musicians do. Any one of you who played the piano or was involved in music had time with their teacher, but then they had plenty of time in the week alone. And this is where an expert is born. Then when they come in surgery, there's also very specific feedback on what they have to do. And in between surgeries, they need to go back to the simulation lab. And this process, slowly but surely, ends up in having the person get focused, objective feedback. They have specific goals they have to achieve. They work in between these sessions with the surgeon, and that's what creates deliberate practice. It's beneficial to the trainee, it's beneficial to the faculty, but most importantly, it's beneficial to the patient. The patients get high quality experience, they get very good outcomes and very low complication rates.